Welcome to this short Materialise Orthoview training video on planning a total knee arthroplasty with a full leg AP image. First, open the study and select the required procedure in the procedure selector. In this case, a total knee arthroplasty on the patient's right knee. Choose the appropriate images from the panel on the left and select Start Plan. The software will then take you to the next step, which is scaling. Before calibrating the image in scaling, check that the software has selected the correct image direction and laterality and has marked the left and right sides of the image correspondingly. Then use the Quick Scale tool to select your marker for automatic image calibration. After calibrating the image, the software moves to the appropriate step for the chosen procedure. Materialise Orthoview detects that you are using a full leg AP image and offers a dedicated planning wizard for this purpose called Smart Knee. The purpose of the automated tools in the software, also known as wizards, is to allow you to mark and measure key points on the patient's anatomy. The software uses this information to perform some initial sizing and positioning of the implants, as well as providing useful metrics such as valgus angle. Tick the box to activate the Smart Knee wizard and then proceed as follows to position the points. There are three areas of the Smart Knee wizard to position. Starting with the ankle, the control points are used to mark first the talus. Then, moving up to the knee joint, the tibial plateau. Next, mark the base of the femoral condyles. Here you can also enter the appropriate valgus angle for your preferred knee implant. And finally, moving to the hip joint, mark the outline of the femoral head. Once these points have been positioned, the autocomplete button causes the software to automatically detect the femoral shaft and place a final control box on the bone. Once all the points of the wizard have been positioned correctly, you can select the template tab to move on to the next planning stage. From this point, you can begin to modify any of the implant's values and its position as appropriate to finalize the plan for the patient. To switch to a different implant, click on the graphical banner. This will display the list of available implants from which you can make a selection. You can now modify the size and other values for your implant as appropriate to identify your preferred option for the patient. Make sure a value is chosen for each of the criteria and that there are no red shaded areas remaining on the left hand side. You will notice that the red shading and the warning message both disappear and the template outline changes to a darker bold color once the value has been selected for all the options. You may pick any value from the largest to the smallest in the settings on the left hand side. However, there may be some restrictions imposed on your choice by the implant manufacturer. These restrictions are identified in a lighter or non-bold font. If an invalid option is chosen, for example a size mismatch, the template in question disappears and a warning message is displayed in its place. As well as selecting the appropriate size, you are also able to freely move the templates around on the screen to set their final position. To move a template, place the mouse anywhere inside the outline of the implant, then hold down the left-hand mouse button and drag. Holding down the right-hand mouse button and dragging allows the implant to be rotated. Corrections can be made with the undo and redo buttons available on the left hand end of the toolbar at the top of the screen. The template can also be moved back to its original position using the To Wizard button available underneath the template banner. For a template that has an axis line running through its center, as do the knee templates, a left click on the mouse will move the template only along that fixed axis. To move the template in any direction, look for the main control point, usually in the center of the template. Place the mouse directly on this point and use the left mouse button for free or unrestricted movement. Once you are happy with the final position and size of the template, you can use the Reduce button in the top left hand side of the screen to see a reduced view of your implant positioning. This allows the software to reposition the leg so that the femoral and tibial components are correctly aligned. Once your plan is complete, you have three options available at the top right of the screen for storing it. Save, commit and close. If you do not wish to store a copy of your plan, simply select close and the work will not be saved. Both save and commit will store a copy of your plan. If save is chosen, the plan is stored in a modifiable format and can be reopened later, should you wish to continue editing it. If commit is chosen, no further changes to the plan are possible. As well as the templated image, Materialise OrthoView also stores a report of your plan. The report can be viewed by clicking the Report button at the top left-hand side of the screen. There is also an option on the main toolbar to allow selected portions of the report to be displayed on the main X-ray. Before using this option for the first time, right-click the icon to set your preferences. Then, left-click the icon and left-click anywhere on the screen to place the report information into the image. For additional hints and tips relating to every stage of the planning process, use the Smart Help tab located on the right-hand side of the screen when using the software.